We do every kind of surgery, anything from craniotomies to back surgeries to OB cesarean sections to open heart surgeries to huge traumas to neonates. Anything you can imagine CRNAs can do. Hi everyone, welcome to another video. My name's Rihanna. If you don't know me, I'm a certified registered nurse anesthetist, or a CRNA, and I've been practicing since July 2020. I graduated CRNA school in May 2020, so I'm a relatively new provider, but today I wanted to talk about what is a CRNA and what do they do, because this is a very common question I get. The general public and a lot of people are not super familiar with CRNAs. So today I wanted to talk about it a little and help educate some people or give people who are interested in becoming a CRNA some more information about what we actually do. Before we get started, I have to do a little ad. If you're not familiar with our new More Than Money platform, John and I, my husband, created a community and a platform mentorship program called More Than Money. And our main focus there is helping people gain control of their finances and become financially free or financially independent if that is their goal, helping people get out of debt and start investing. I also do nursing and anesthesia mentorship on there. So if you're interested, click the link below. It'll be in the description. You can come over and join our awesome community. Back to the video. Quick little history on CRNAs before I get into all the details. So CRNAs have been around for about 150 years providing anesthesia. They provided anesthesia in wars, in the military, and just in general. They were one of the first anesthesia providers. And back when it first started, there wasn't exactly a formal training, but over the past recent years, it has become more of a formal education path, resulting in a master's or doctorate degree. I have a doctorate degree, but there are still some master's programs, but actually next year in 2022, all the master's programs will be eliminated and there will only be doctorate level CRNAs. I actually made a video about that, so if you're interested, I will put it in the description below. But going forward, all CRNAs will be doctorate prepared. So CRNAs are APRNs, or Advanced Practice Registered Nurses, which means that they were registered nurses working in the critical care specialty, and then they went back to graduate school to do anesthesia training. That training consisted of 3 years for me, 3 years of intensive academics and clinical training. And then once I graduated, I sat for boards and then I started working as a CRNA. As CRNAs, we can practice independently as advanced practice providers. So we can work by ourselves without a physician in different hospitals and institutions and surgery centers. But it actually depends on the state and what institution you work in, whether or not that's allowed. It has to do with billing and things like that. So in the state I work in, we are allowed to practice independently, but at the hospital I work in, we practice in a team model with anesthesiologists. So that can be kind of confusing to understand, but it's kind of similar to nurse practitioners who can work on their own, but also work in a team collaborating with physicians pretty often. So what we do is we provide anesthesia. We provide all aspects of anesthesia. Pre-operative care, that is making sure the patient is safe for surgery, assessing them pre-op, doing a history and physical, assessing all the medications they take, what kind of diseases they may have, how those will impact their anesthesia, and also during that time we're making an anesthesia plan, what kind of anesthesia we'll be doing, and that depends on the type of surgery the patient's having and the patient's medical history. Anesthesia is very patient specific, which is why I think it never gets boring, because everybody's different. You have to tailor your anesthesia to your individual patient, depending on everything that's going on. There's so many different factors. So we do the pre-operative assessment, decide the patient is safe for surgery, and then decide what kind of anesthetic we're gonna do. Then in surgery, we provide intraoperative care, which means we basically take over for the patient, because once they go off to sleep or we put them under anesthesia, they're incapable of doing anything themselves. Their body is not regulating itself, temperature, blood pressure, heart rate, all that kind of stuff like it normally would. So we're there to give medications, fluids, blood products if needed. We breathe for the patient with our anesthesia machine and ventilator. So we make sure they're getting oxygen and we make sure that they're safe. We give them medication for pain, nausea, blood pressure, heart rate, really anything you could possibly think of, we're treating, and we're constantly assessing the patient. Their labs, if it's a longer case, we're sending blood work, getting back their labs, checking on that, and also keeping in contact with the surgeon during this time, because yes, we're all in the same room, but we're kind of doing our own thing. So we're keeping in contact with the surgeon to see what's going on, making sure that the whole team's involved. Essentially, to summarize all that, we're taking over the patient's body systems, making sure that everything is functioning as it should while they're under anesthesia, making sure they go to sleep safely, and then when the surgery's over, making sure we wake them up safely. But it's not as simple as just waking them up, because we want to make sure they wake up comfortable, pain-free, or the littlest amount of pain as possible, nausea-free, and we want to make sure that they're not having any issues once they wake up from surgery. So that kind of leads me into the thing we do last on this spectrum of operative care, and that is post-operative care for patients. So we also watch patients post-operatively, making sure that they're safe in the recovery, or the PACU, which is the post-anesthesia care unit, making sure their pain is controlled, making sure that their oxygen levels are good, their labs are good if they need labs, their nausea is controlled if they happen to have nausea, and making sure that they're either safe to go home or go to the unit that they're going to be staying on in the hospital. Now, where I work, this is a team effort because we work with anesthesiologists, so usually I'm in a case during the post-operative period, and the anesthesiologists follow the patients post-operatively. But if I worked somewhere independently, I would be doing pre-op, intra-op, and post-operative care. So I just wanted to clarify that in case it's confusing, because we do work with anesthesiologists many times. So we all work together. And another thing that CRNAs do, which people are very interested in, is regional anesthesia. That includes peripheral nerve blocks, such as intrascalene blocks or adductor canal blocks or femoral blocks. Those are blocks all over the body. If you're not familiar, it's basically when we insert a medication into a specific area to numb that nerve, in simple terms, and give numbness to the arm or leg or wherever the surgery is happening. And so this can be used to provide pain relief in surgery, and it can actually be used as an anesthesia in itself. If you have a good enough block, you might not need any anesthesia, or maybe you only need, well, the block is anesthesia, but maybe you only need a little bit of pain medicine or medicine to help with anxiety. You don't need a general anesthetic is what I meant. So it really depends. It can also be used for post-operative pain. So you can do a general anesthetic, do a block, and then use that for post-operative pain, or they can all be used together for many different things. Another level of this is spinal and epidural anesthesia, which is very commonly used in OB, which is when people are having babies. So we do that as well. And it also can be used for other surgeries. You can use spinals for knee replacements, surgery on the lower extremities, and you can use epidurals for pain control after various different surgeries. So I've been kind of focusing on intraoperative or surgical anesthesia, but anesthesia can also be used for chronic pain management or even acute pain management that doesn't involve surgery. So these peripheral nerve blocks can be used in situations where maybe a patient has cancer or has a very painful process going on, and they don't necessarily need surgery, but they do need pain control. So it can be used in that aspect. CRNAs can work in pain clinic or pain management centers, which are centers that are specialized in pain, because as anesthesia providers, we are experts in pain management. So there are centers for people who have chronic pain issues that are very hard to control, and we can work in those centers as well. Hospitals usually have a pain management team too, so CRNAs could be part of that team, which I think is awesome. And there are also fellowship or advanced practice opportunities for CRNAs after they graduate CRNA school and start practicing to go back and do a specialization in short and long-term pain management. So there's a lot of different ways that your career can go, but they all kind of intertwine, and you could do a little bit of everything. The last thing I wanted to talk about is CRNAs working in critical care, especially with COVID. This has come up in the recent year. So CRNAs are qualified to work in critical care. Essentially, anesthesia is critical care because you're taking care of every body system. And we also take care of many, many, many patients from the ICU and provide their anesthesia. So working in critical care, for example, when COVID was going on and we didn't have any elective surgeries going on, a lot of us CRNAs floated up to critical care and helped. So we helped with starting IVs, lines, intubations if needed, and just taking care of patients in general, doing their medications, monitoring their labs, doing what we would do as an ICU nurse with some extra privileges that we're able to do as CRNAs. We can also manage ICU patients without doing the hands-on care, so managing them, helping put in orders for the nurses and things of that nature. I haven't personally done that as a CRNA. When I went up there, I was more hands-on, but that is an aspect that can be considered. And a lot of places were using CRNAs for this because there were so many COVID patients in the ICUs, and the physicians and nurse practitioners were just overrun, and PAs, I don't want to forget PAs, but everybody was just overrun. There was too many patients for them to take care of, so a lot of CRNAs floated up and helped manage patients who were critical and complex with COVID. And one more thing I wanted to throw in here is CRNA scope of practice limitations. So we can do all aspects of anesthesia care, regional anesthesia, critical care management, and we can also work independently, but in many situations we do work in a team model along with anesthesiologists, so our physicians are medical doctors. Where I work, I feel like we're pretty autonomous, so we do work with physicians, but it's very much a team environment, so we talk to them about what the plan is, what I'm thinking, what they're thinking. Usually we're all on the same page. We talk about what our thoughts are, they talk about what their thoughts are, we talk about what might be different and why, and I feel like we have a really good relationship. So it's really great to get a couple different viewpoints on something complex that's going on. We do every kind of surgery, anything from craniotomies to back surgeries to OB cesarean sections to open heart surgeries to huge traumas to neonates. Anything you can imagine CRNAs can do, there's no limitations there. And also we respond to traumas in the emergency room, high-level traumas, and we do all the intubations on the floor and in the ICUs for codes and airway emergencies. Sometimes we go on several of these calls a day, so that's another aspect of this job that I really love. In every hospital it's not like that, but it is like that where I work, and that's one of the reasons I chose to work here. So that kind of wraps up a general overview of what a CRNA does and who they are. I hope that it was helpful for you. I love talking about it. I love my job. I'm very passionate about it. And actually, speaking of surgeries, tomorrow morning I'll be doing a craniotomy surgery, so neurosurgery on the brain. I do that pretty often because we work in a center with a lot of neurosurgeons, so I'm excited about that. I know because our assignments come out a few days ahead of time sometimes, and during those we put in extra IVs, sometimes put in lines, put in arterial lines, they get a Foley, the whole works, general anesthesia. So anyways, I hope you find this helpful, informative. If you have any more questions or comments about CRNA practice, make sure you leave them below and I'll try to get those answered for you as soon as I can. As always, I really appreciate you guys watching. I love your interest and passion for anesthesia, and I will see you next week.